Welcome to the second episode of our Basic Professional Toolkit series. In this video, we will be tackling how to write and orally present our patient's case using SOAP, which includes subjective, objective, assessment, and plan sections, hence the acronym SOAP. The subjective section includes details about any significant events and any new complaints the patient has. The objective section is a report of the physical exam, focusing on any changes since the last examination and any significant new laboratory, imaging, or other diagnostic results. The assessment presents the complaints and diagnosis. For the initial patient complaint, you do not have to restate your differential diagnosis if the diagnosis is known. For new complaints, however, another differential can be raised and compared for or against each diagnosis. Lastly, in the plan section, it details the need for additional testing and consultation with other clinicians to address the patient's illnesses. It also addresses any additional steps being taken to treat the patient. Mastering SOAP notes takes some work, but these will help you as future physicians to document and communicate patient progress for both clinical and legal purposes. To help you improve your charting, here are some tips in writing SOAP notes. Number 1. Avoid biased or overly positive or negative phrasing. Number 2. Be specific and concise. Details should be specified without being overly wordy. Avoid statements that are vague. And number 3. Avoid overly subjective statements without evidence. Describe client's behaviors without making assumptions about the client's internal state that lack specific support. Here is an example of SOAP charting to help you visualize what SOAP notes look like. For this case, we have JL, an 8-year-old male who is currently on his 3rd day of admission. The patient reports of muscle and joint pain, but with no associated headache, nausea, or vomiting. He also complains of stomach pains with a pain scale of 6 out of 10. Now it's time to write our SOAP notes. The subject section describes the patient's self-report of their current status. Avoid writing irrelevant data. Under objective, list down the objective data of patient encounter, including vital signs and physical exam findings, as well as laboratory data and imaging results if available. Be reminded to use measurable terms that will help in the reassessment. A common mistake here is distinguishing between symptoms and signs. Symptoms are the patient's subjective description and should be documented under the subjective heading, while a sign is an objective finding related to the associated symptom reported by the patient. In the assessment, we synthesize the subjective and objective evidence to arrive at a diagnosis, which in our case is dengue with warning signs. The final component of the note outlines the planned interventions to be used. Specify frequency, treatment progression, equipment required and how it will be used, education strategies, and referrals if needed. Avoid vague plan descriptions such as continue treatment. The oral presentation is just as critical among the skills of healthcare professionals in communicating patient care with other providers. The format differs from a patient write-up in that it is shorter and more focused, providing what the listeners need to know rather than providing a comprehensive history that the write-up provides. In giving the report, 3 things should be kept in mind. Number 1, the method, which pertains to the format of the presentation depending on hospital course of the patient. Number 2, the matter, which is the main content based on a standard outline of history taking. And number 3, the manner on how to deliver the case in a concise but comprehensive way. First, let us discuss 2 ways of presenting our patients. New patients get the traditional history and physical exam with assessment and plan. The review of systems is often left out as anything important was already in the history of present illness. The physical exam is reviewed and only give pertinent positives and negatives. The follow-up presentation differs from the presentation of a new patient. It is an abridged presentation referencing major patient issues that have been previously presented, but focusing on new information about these issues or what has changed. Briefly review the physical examination and admitting diagnosis. Then report any new findings, laboratory tests, diagnostic procedures, and changes in medication. When presenting a newly admitted patient, take note of the following. Provide enough information so that the listeners can understand the presentation and generate an appropriate differential diagnosis. Present a thoughtful assessment. Present diagnostic and therapeutic plans. Provide opportunities for senior listeners to intervene and offer input. Meanwhile, when presenting a patient who has been staying in the hospital for a few days already, remember to inform the listener of 24-hour events and plan moving forward. Promote focused discussion amongst your listeners and supervisors. Make opportunity to reassess plans and adjust as indicated. And demonstrate your knowledge and engagement in the care of the patient. Next, we move on to the matter or content of our oral presentation. The opening statement should give an overview of the patient, age, sex, reason for visit, and the duration of the complaint. For ongoing care, give a one-sentence recap of the history. This will be very similar to our written HPI. Present the most important problem first. If there is more than one problem, treat each separately. Present the information chronologically. Cover one system before going on to the next. Characterize the chief complaint according to quality, severity, location, duration, and progression, and also include the pertinent negatives. When you do your first patient presentation, you may be expected to go into detail. For ongoing care, present any new complaints and highlight changes for the past 24 hours. Most of the ROS is incorporated at the end of the HPI. Items that are unrelated to the present problem may be briefly mentioned in this portion. For ongoing care, present only new complaints. List the diagnoses of PMH in decreasing order of importance and relevance as they relate to the HPI or the care you provide for them in the encounter. Include the elements primarily that are relevant to the patient's presentation or your care of the patient. Note particular family history of genetically based diseases. Include all significant abnormal findings and any normal findings that contribute to the diagnosis. Give a brief general description of the patient, including physical appearance. Then, describe vital signs by giving a range rather than just the most recent values, as you wish to summarize the patient's vitals over the course of the day since your last presentation. Do not use vague phrasing such as a febrile, vital signs stable in an effort to be brief. Include the relevant labs explicitly. Give the actual numbers rather than just saying normal. Include comparison labs if there has been a change and if you feel it to be important for interpretation. The physical exam should be brief and typically not comprehensive. Focus on the portions of the physical exam that you are actively following for the patient's active problems, even if normal, and anything that has changed from previous exams. Typically, the most serious problems and the ones relating to the chief complaint go first. For each problem, present an assessment and a plan. The assessment is your sense of what diagnosis is most likely and why, or your understanding of the patient's state. The plan is what you intend to do about it, either diagnostically or treatment or both. If a problem has been resolved, mention it briefly if still relevant, but if no longer relevant, do not include it. Last but not least is the manner of oral presentation. The presentation is typically given in just a few minutes. No time should be wasted on superfluous information, because one can read about such matters later in your admission notes. The goal of any oral presentation is to pass along the right amount of patient information to a specific audience in an efficient way. And here are some tips on how to do just that. Number 1. Include only the most essential facts, but be ready to answer any questions about all aspects of your patient. Number 2. Present problems systematically. Beware of jumping back and forth between descriptions of separate problems. Number 3. Use the presentation to build up your case. Your reasoning process should always help the listener consider a differential diagnosis. Lastly, remember to present the patient as well as the illness. Don't just look at the condition of the individual alone. And that is all for charting using your SOAP notes and giving a good oral case presentation of your patient. We hope this video helped you to establish good documentation and communication skills as future physicians. See you in our next video in our Basic Professional Toolkit series.